I think the biggest challenge that I face every day is alignment of the work that I do in reference to diversity and inclusion with the broader healthcare strategies and initiatives. Our senior leaders are very engaged in the work that I do. Driving it down further in the organization is where we sometimes hit a roadblock. Diversity and inclusion is one of our 3 strategic objectives at Christus Health. So it is a high priority. It is on our scorecard. But once it hit a certain level, we kind of stall. And so our goal is to continue to drive, embed, and align diversity and inclusion throughout everything we do from a business standpoint within our organization. So we're educating. Education is an extremely important piece to our strategy. So educating diversity and inclusion throughout the organization, building cultural competency. We have alignment in reference to equity of care. So healthcare disparities is one of our #1 priorities. Aligning all of our associates as it relates to the patient is a critical component of our overall strategy as a business. And the populations that are typically involved in healthcare disparities are sometimes misunderstood. So the cultural competency piece is really critical. I think what's holding us back is the lack of accountability, the lack of understanding and knowledge about the impact, the value that it brings from a business standpoint, and how it aligns to our business. So we're still working on those things within our organization as an entity, but I think all organizations should be very focused on alignment to the business imperative of diversity and inclusion, how it's going to impact us long term with the changing demographics, with all the things that our senior leaders are worried about with population health, the triple aim. All those things have a diversity impact, and we have to be smart about it and make sure that we are paying attention to this work as it relates to the business things that they're worried about. Well, I would say in our organization, we've paid very close attention to the diversity of our organization, looking at how diverse we are in our most senior roles. It has been part of our scorecard objectives for the last several years, the last 3 years, and we've made significant progress. I think that what gets measured still gets done, so our senior leaders have been held accountable for growing diversity and inclusion.